Welcome to Beyond Bitewings, the business side of dentistry, brought to you by Edwards and Associates PC. Join us as we discuss how to build your dental practice, optimize your income, and plan for your future. This podcast is distributed with the understanding that Edwards and Associates PC is not rendering legal, accounting, or professional advice. Listeners should consult with their business advisors before acting on any of the information that is shared. At Edwards and Associates PC, our business is the business of dentistry. For help or more information, visit our website at enassociates.com. Hello and welcome to another episode of Beyond Bitewings. In today's episode, we have a very special guest. Her name's Beth. She's with the Global Medical Virtual Assistance Company. She's the founder and the owner, and it is with great pleasure that I welcome her to our episode today. Hi, Beth.
Hi, thanks so much for having me, Ash.
Oh, absolutely. Thank you. The pleasure is all mine. And honestly, this is something, when I saw what your company does, I felt like, okay, we really need to have her on our podcast and talk a little bit about it, because I feel like not just our clients with the firm, but also our listeners would love to hear more about this, because this is something they've been considering, but sometimes they tether because this is not the model that they've heard of a lot, or, this is something they have a lot of friends that have dived into already. So, it'll help with someone like you to share a little bit about what it is and how it may actually help our clients, especially the business owning clients and listeners that we have.
Absolutely. No, my pleasure. It's definitely been a new way and a new wave of how to have remote staffing and being able to either scale a practice very easily and or just to help alleviate some of the very hardworking staff members they already have, that they don't want them to leave. So we need to add additional staffing to help them.
That's correct. Yes. So tell our listeners a little bit about yourself and how you came about this company.
Yeah, I actually was thrown into this. I came from a medical background. I've been in the medical space and the pharmaceutical industry and also the specialty pharmaceutical and pharmacy space, and then surgical devices. And I had a spouse at the time that was doing virtual assistants for real estate. And through a bad partnership breakup, I immediately quit my job, jumped in with him to help him with the real estate side. And because of my medical background, I knew that this would be a really great adventure and a great business, and definitely fulfilling a need. And I paid attention while I was in all of those medical practices and in the hospitals for 20 some odd years. I paid attention to everything that was happening around me. And so I knew all the different potential where virtual professionals could fit in. And so that was the launch of this brand, and this company was, 6 years ago, and has been an exciting way to go. So that's kind of how I got started. I'm aging myself, but I've been in the medical industry for 25 years. And it's been an exciting ride, but most definitely to be on this side of things in terms of really, really helping practices scale and helping on, patient care with the administrative tasks around patient care. It's been really, really, really a super fulfilling role and company to work with and to grow.
Amazing. Okay. And you actually mentioned something there. So it's basically administrative assistance for practice owners.
Yes. Yep. Absolutely. Everything and anything administrative work and administrative care around patient care is what we can do and what we can handle. And so how I describe what we do, just to simplify it, because we do hundreds of different types of tasks for medical practices, but just to kind of break it down, I kind of break it down to 3 legs of a stool. And the 3 legs of a stool is your front desk, front office staff. So remote reception work, being able to handle every and all calls coming in, patient scheduling, full new patient intakes, that sort of thing for specialties. So that front desk all can be done, and a lot of what can be done remotely. So that's one leg of the stool. Another leg of the stool is sort of the administrative work, like insurance verifications and prior authorizations.
Mhm.
This is heavy, heavy lifting now that needs to be done in medical practices and or hospitals that is really bogging down and bottlenecking up patient care in the practices. So your mid-level practitioners, even your medical assistants, they are the ones that are typically doing those insurance verifications or prior auths while they're also trying to put patients in a room, while they're also having to work directly with the physicians. So that is really where our specialty specifically really lies, and a lot of the heavy lifting is devoted to our team to getting that done. So that's another another leg of the stool.
I
The
see.
third leg of the stool is revenue cycle. Everything and anything back office billing. So when you're talking about claims, denied claims,
Mhm.
redoing them, resubmitting claims for appeals, and also patient billing for collections and beyond. So everything and anything within the revenue cycle. So that's that third leg of the stool, just to kind of break it down. But there's hundreds of other tasks that
Mhm.
we do. But just for simplification, that's the best way to describe what we
I
do.
see. I see. Yeah. And I know you cater to basically the majority of the medical world, but since our podcast is specifically focused on the dental world, I'm assuming you also cater to the dentists out there, right?
Absolutely. I mean, a lot of the dental practice run exactly like a typical medical practice.
That's
So you're
correct.
still dealing with patient care, you're still dealing with that front desk, with patient scheduling, patient appointments, consultations, and beyond. So, and there's still insurance verifications that need to be done,
Mm-hmm.
and beyond, right? That has to happen. So there's a lot of administrative work around patient care and dental practices.
Right, 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 right. And it's interesting that you mentioned all these things. Like as you were listing them, I'm like, yes, there's a need for that. Yes, there's a need for that.
Mhm.
Yes, there's a need for that. Oh my goodness, yes, there's a need for that. It almost sounds like, it's a one package kind of deal because I'll be honest with you. I speak with my clients, I don't know, 4 to 5 times at least per day. And
Mhm.
out of those times, majority of the times they're complaining about having difficulties with the front desk
Yep.
responsibilities. So one, the scheduling, the calling, the recall program, and then of course with the clients that are accepting PPOs, the insurance filings, those claims, and then of course the revenue cycle that you were talking about. Taking into the accounts receivables, how much is there? Is it growing? What do we have between 0 to 30 or 30 to 60, and how do I manage it? And oftentimes, what I hear from my clients is that, Ash, I never thought that I would have to spend so much of my time and energy into managing the front desk area. I always thought, I went to dental school, I'm a clinician. I'll
Yep.
probably spend just a small amount of my time managing the practice and the rest of the time doing what I love, but it's actually the opposite.
Oh,
Um,
absolutely. I mean, it's a business, and a lot of physicians or dentists are not trained on being businessmen or businesswomen.
that is
Women,
correct.
they're trained on, within medicine. I mean, that's what they specialize in, and that's what they think their focus is going to be. But if they're going to be in private practice, that means they're really spending probably 60% of their mind space will be on running the business.
Yeah.
And so medicine, dental practices, and medical practices are it's a business. And
Hmm.
so there's a lot of management that has to happen in terms of it's not just patient care. It is, workforce
That is
management. It
correct.
is software management. It is paying the bills, keeping the lights on management. All of those things have to happen.
Right. And I think the biggest headache is the HR piece of it, is managing
Mhm.
the team that they have. That's
Yeah,
well,
what used to be, oh, the angry patient or the irate patient or the complex patient used to be the focus. Now it's the irate front desk manager or
right.
receptionist or just the daily headaches of really trying to manage people.
That is
And so that has really, especially our workforce has drastically changed during COVID and now post COVID.
mm,
It is such a different beast.
hmm
And so that's, we're all dealing with this in every industry, but specifically the medical industry is also taking a major hit on this
hmm
because business can't slow down. There's still patient need. There's still emergencies. So it's a tremendous amount of workload that has to continue to happen, regardless of whether or not you're properly staffed.
Right, right. And I also want to mention something here. Piggybacking off of what you said, you're right. These clinicians, when they went to school, they were not trained enough on the business side of what they will be doing, and that is the initial struggle, right? And then what happens is once their business gets to a point where they're hiring more and more people to run their practice, the front desk area specifically gets neglected. I feel like. Uh, Oftentimes I've seen clients where they're looking at the numbers, they're like, oh, this is the amount of money I can spend towards hiring someone new. And they're basically going off of the number and not by, let's say, the quality of the experience that they bring. And then other times when they do focus on that, they're not focusing on the numbers and their margins shrink. And, specifically with COVID, after COVID, I mean, with the quote unquote great resignation, there's been a huge shift in this market of finding people, quality people, good people, or even people in your field like hygienists, for instance. They're still a unicorn. They're super hard to find. But again, I'm going off a tangent here, but coming back to the administrative side, the front desk side, that's still difficult. The clients are used to paying a certain amount of money to these people on an hourly basis or on a salary, and then all of a sudden it literally shifted overnight. Now their reimbursement rates from the insurances, that hasn't changed. So now they're trying to figure out, okay, how can I afford my increase in overhead by paying more? Do I do this or do I make cutbacks on other expenses? It's just chaotic. And the thing is, when the shift happened, some of my clients, the more savvy clients, the ones that are more proactive or more eager to changes, they made the change, right? Because the old business model is where you try to find good quality people, you hire them, you keep them happy, you maintain a culture, and then you just make sure they stay on board as long as they can so they can give you or provide you the help that you need. However, when that in itself, there's a rarity, right? Like there's not enough people,
Right.
the kind of people, so you have to look or think outside the box. And that's the era we're in. I call it the new
Yeah.
era, and you honestly are part of the new era. The
Yeah.
virtual assistants, the front desk. See, considering that option, because does it work? I know some of my people that are sticklers of not changing things. They
hmm
are still a little skeptical about this. They're like, no, the human element, this and that. Well, it's not. And I know we're not saying that just completely get rid of the front desk. You'll still have that one point person, but the rest of it might be more effective. It might be efficient. It might be cost effective, and you don't have to deal with the headache. Oh no, another one of my employees just said she's going to go on maternity leave or take a break, and I don't have enough time to find a replacement. What am I going to do? Working with the virtual company kind of negates all of that, right? Because I'm sure you have a lot of people already on your team where if somebody's off, somebody else will cover that spot. So there's like a seamless production or output from their end that can
Yeah.
help the front desk area of these dental practices.
Yeah, I mean, and front desk is just a tip of the iceberg, but most definitely, I think what we're finding is that people, some of the practice owners, if they're unwilling to change and look outside of the box of how their staffing solutions have looked in the past,
Mm-hmm.
if they're unwilling to look into another direction, what they will see is they will see a shrinking population of patients coming into their practice. They will also see a lot more of their internal staff members leaving, either leaving for better opportunities or leaving because they're overwhelmed and you need to find additional staffing. And as we just discussed, additional staffing is not so easy to come by.
Mm-hmm.
So then, of course, not to, not to circle back on this again, but with that, then there's less revenue coming in, and then there's cutbacks, and it all is going in the wrong direction of what the initial intent was. So what we have found, and which is really exciting, is that virtual assistants and utilizing, and these are live human beings. This is not AI. It's not a bot. These are live human beings. So that personal interaction and personal touch in patient care still continues. which is critical, right? And that's one thing that we want to make sure continues and happens in patient care. But the wonderful thing is that we're able to really get virtual assistants to be widely utilized in the medical field where it wasn't utilized before. So, like I think I had an earlier conversation with you about the fact that virtual assistants and virtual professionals have been utilized in other industries for a number of years, well more than a decade, widely used in other industries. The medical field, the dental field just had not pushed forward yet with the thought process of, yes, this is possible. With COVID forced the hand of medical practitioners to understand and realize that telehealth is possible, remote workers are possible, remote staff is possible. And not only is it possible, you touched upon two other things that's really critical, is they can still be extraordinarily efficient and it is extraordinarily cost effective if you work with the right company. So that's, some of the great things about the timing of all of this is that we are launching into something that is, we know works. We know it works in other industries, and now because of our hands have been forced in the medical industry, we now know it also works in the medical industry. So what's critical, and like I just touched upon, is that making sure that you are utilizing and working with the right company to be able to find the right staff. With our company, with Global Medical Virtual Assistants, I don't consider that such a dirty word in the United States about outsourcing, right? We're offshoring or we're outsourcing. That's not how I sell our services. That's not how I even look at our services, because we truly are an extension of the practice. We have dedicated virtual assistants to dedicated practices. They're not working for, Dr. Smith and then Dr. Adams in the afternoon. They are only dedicated to your practice or your facility. They become working closely and working tandem with the staff members in the practice. So we're an extension of, not an outsource or an offshoring of like outsourcing tasks. That's not how we function. And that's what makes us work so incredibly well within the practices and makes it function and work incredibly well in terms of efficiency and making sure that the patient care still stays where it stays. We touched upon like that front desk and how critical it is that we have somebody really great at the front desk. And now what we've learned is that receptionists are demanding a lot more, and they're demanding even what a nurse would be paid, right? Or a technician in the back, right? And so it's really strangling the business aspect. It's really strangling the budget. And so patients are expecting a white glove service. We need somebody really strong and really great at the front desk, or a team at the front desk that is that caliber. So it's a matter of rethinking, okay, can we have one or just two people at the front desk, and then utilize remote receptionists to handle to handle all the rest of it? And that's possible. We've proven it. So it's just another way of thinking and kind of thinking outside of the box, where then you can still manage the budget appropriately. You can still pay a really strong receptionist to be live within the practice, one or two, and then have additional staffing to support that with remote receptionists.
In fact, Beth, I would really appreciate it if you could take this moment to actually brag about how effective this is, because I see it on my end with my clients that have actually implemented it. I've seen the huge difference, but I'm basically wanting someone else to vouch for this as well with me, that this really works, and this might be something to look into.
I'm passionate about it, very passionate about it. So it's exciting for me. Of course, I love to brag about this industry and what's amazing and what can be done. And I think one of the best ways that we have been able to have that proven success, right, is that we have had extraordinary growth in our company, just extraordinary growth. And it's not because the industry is moving in this direction. It's not because we just had a great sales team and we're out, at conferences, and we're beating down the doors of dental practices and hospitals and medical practices. It's because our existing client base, they may have only started with 2 virtual assistants, and then very quickly realized, oh my gosh, this is amazing. This is incredible. We love working with Global Medical. And so then they start adding on VAs. So 60% of our growth has been with their existing clients. So
Wow.
that means not only are we doing an amazing job, our virtual professionals are incredible. Our relationship with our clients are fantastic, but they see the value. They see how incredibly well it works. And so they immediately start diving into, okay, what other departments can we utilize medical virtual assistants? How can we grow within our practice utilizing this staffing solution? And so that's where, so I mean, the proof is in the pudding right there,
Hmm.
just based off of our growth, off of our existing client base. So we've had some clients that have started with 5 VAs and now have 50. We have some clients that started with 12 VAs and now have 120. So those are obviously massive practice groups, but the proof is in the pudding right there. So that's exciting for me because then I know as a business owner, not only do these strategies work, but we're the right company to partner with to do it. And so we've really created amazing strategies to build those relationships and make sure that the virtual professionals that are assigned to the practices, they also come with a client service manager as part of our services. So we have a full management team that's then also managing the VAs to make sure they're clocking in on time, they're logging in on time. When they take their lunch break, they're coming back from lunch on time. They're hitting the productivity levels and the KPIs that are set for them from the practice and the client service manager, and we're managing them. So we come with a full service management team as well. So that's like kind of like, you wanted me to brag a little bit about, I can brag about our company, I can brag about the industry. It's definitely, we're a solution, which
Hmm.
when we're a solution, that's a fun business to be part of. And so that's kind of where we found our niche.
Well put. Well put. You're absolutely right. I do feel like the industry you're in right now is definitely the solution. Now, let's
Yeah,
talk a little bit about numbers because we did
sure.
talk about, this is highly efficient and very cost effective. So, and it's completely up to you if you want to share the exact numbers or you could just give percentages. Let's say,
Sure.
somebody were to hire a regular front desk person versus, utilize your services or a company of similar nature's services to have a similar output. What would be the cost variation between the
Yeah,
two?
no, great. Thanks for asking. And actually, you can find this information on our website as well. There's actually a tab that kind of goes to the cost effectiveness of this. But, where we are, about under $25,000 a year for a
Mm-hmm.
full-time medical virtual
Mm-hmm.
assistant,
Mm-hmm.
that same position in a medical practice would usually cost double, if not more than that, depending on where you are in the country.
Mm-hmm.
But for the most part, what we've done and continue to do more research, and we pull data, obviously from different areas
Mm-hmm.
and within different practices. We try to pull data around the country to make sure that are we still a great staffing solution, and we are. And it's such a massive difference. So our pricing is really straightforward. We are $525 a week per full-time VA. That's it. There's no additional fees. There's no additional anything. All of that is part of
Mm-hmm.
that. So it's $525 per week per full-time VA. That comes with our full team, that comes with our management team, with a client service manager, that comes with our IT team, that comes with our HR team. All of that is covered, and our virtual professionals are just that. They are professionals. They come to us. We recruit and only bring in virtual assistants that have a 4-year college degree. So they have a bachelor's degree. They either have a bachelor's degree in nursing or they have a bachelor's degree in something in the medical field. And they've worked within the medical field in some facet, some way or another. They have to have experience before we'll hire them. So I don't know where else, especially in the United States, where you would be able to get a college educated, college degree
That is true.
person to put at your, either in your reception area and or in your back office for under $25,000 a year. We are a fraction of the cost of what it would be to hire someone in the practice.
That is amazing. And you said something else, which is you said most of your staff are from the United States?
No, our staff is entirely Philippine based.
I see.
We are in the Philippines, which
Mm-hmm.
is that's how we're able to offer pricing that actually can work for a medical practice and or a dental practice. That's what makes us cost effective, cost efficient, and budget friendly for practices. And we're not a replacement of. That's one of the things that has been really exciting for me as a business owner. I didn't launch the business for us to replace existing office staff. The idea is that it's the ability to be able to grow from your existing onshore staff that's in your practice now. It is not for cost savings to, oh, we have 2 receptionists now, we're going to eliminate 1 receptionist and hire offshore. No, that has not been the direction of what our practice, at least what we have seen from the practices that partner with us. What we have seen is they really want to hold on to their existing staff. We are to enhance what they already are offering, and or to take some of the load off of the existing internal staff because they're overwhelmed, they're overworked, they're overwhelmed, and their morale is low and they're on the verge of quitting. So like you said, there was the great resignation. There's also something called quiet quitting.
Yes.
And so with that, you want to hold on to your really great staff members. So that's your opportunity to be able to have some of the one-on-one conversations with with your internal staff to say, what do you love about your job? What could we get off your plate to delegate to someone else? It would really make the morale of our team go up, the morale of you on an everyday basis go up, and feel really valued and loved to come into work every day. And once you have those one-on-one conversations, there's a lot of clinical aspects that cannot be delegated to someone else outside the practice, like a remote worker, like something like what we offer. But most definitely a lot of the administrative tasks that you are paying, you're paying someone $45 an hour, but they're doing $10 an hour tasks. Those are the tasks that you can get off of their plate to delegate to the medical virtual assistants. And then that staff member or staff members are spending their time more with patient care, more time directly with the physician to enhance the practice. So that's where the differences can be, where it's not just eliminate staffing to then replace with medical virtual assistants. It really is to enhance the practice and keep your staffing and be able to scale, or try to help with the morale of your team to keep the great people that you already have.
Right. And let's not forget, the owner can actually focus more on the clinical side of the business.
Absolutely. Without question. And of course, that comes with having the right practice manager in the practice. And as soon as your practice manager in the practice also has the right staffing solutions, that immediately can elevate the physician or the practitioner out of some of those daily decisions that have to be done with running the business.
That's right. Well, thank you so much for being on our episode today, Beth.
Ash, I'm so glad you invited me on. It's always exciting to talk about this very fun staffing solution for practices.
Oh, I'm sure. I can tell you're very passionate about it. And, you brought it through into our episode today. And I'm sure our listeners will be able to listen to it and feel it from their side.
Absolutely. Thanks for that.
Thank you. Thanks for listening today. Be sure to subscribe to Beyond Bitewings on your favorite podcast platform. For more information, you can follow us on Facebook, Twitter, and LinkedIn, or reach out to us on our website. You can also shoot us an email at info@eandassociates.com.